At the American Academy of Allergy, Asthma, and Immunology's annual meeting in Washington, we spoke with Dr. James Sublett, clinical professor and section chief of pediatric allergy at University of Louisville School of Medicine. Dr. Sublett is also managing partner of Family Allergy and Asthma and a clinical investigator with Family Allergy and Asthma Research Institute. He is the founder and chairman of Allergy Zone.
Well, atopy or atopic state is really the genetic predisposition to become allergic. And then there's a term we call genetic plasticity. And what that means is depending on you're born with the genetic tendency from your parents or your grandparents, and then depending on your exposure to different things in your environment, you may or may not exhibit the disease. So even though you have the genetics to be allergic, you may not wind up having significant allergies. On the other hand, people that have the genetics who have certain exposures wind up becoming allergic. There's been a fairly good number of studies have been done in the last 10 years or so, and there's a hypothesis we call the hygiene hypothesis, which actually shows from a large population standpoint, it's important to understand this is not on an individual basis, that if you have exposure to certain things in the environment, you may not develop allergic symptoms. But these things are a lot of times out of the control of the individual. So from a standpoint of an individual, what can we do? Generally, we'll tell parents, if they know they have a strong family history of allergy and asthma, one of the most important things to do is not allow tobacco smoke in the house. That's a really important message that is recurring. A second thing they can do is consider what they feed their children early on. There's been some controversy about this, but in general we recommend that they be conservative in adding foods into their diet. And breastfeeding, of course, is important. And if they have any sign of a dairy allergy or even soy allergy, which can occur, it's best to use a type of formula that are hydrolyzed formulas, and that's actually been shown to reduce allergic responses. You certainly want to talk to your pediatrician or seek advice from an allergist related to this before you would automatically switch your child to that. A lot of times food allergies are really not food allergies. They're intolerances, or they could be a child having reflux where they're spitting their formula back up and so forth. So the dietary recommendations by the Academy of Pediatrics have been in the past to withhold any type of foods to around 6 months of age. But certain foods like nuts, peanuts, shellfish, etc., tend to be more allergenic type foods. So I still feel that if you have a very strong family history of food allergy, it's probably better to wait and not introduce those foods very early on till we have more scientific evidence about the long-term outcome. Other things you can do are just in general be aware that if you have signs of allergy to animals and those kinds of things, it's better to maybe keep those at least out of the child's bedroom. Not necessarily enough data that we have that you can just say eliminate them from the home. But if they're showing allergic symptoms already, and this can occur as early as a few months of age, that's when you want to seek recommendations from either your primary care doctor like a pediatrician, or go to an allergist and have them evaluate the situation and help you decide what the next steps should be. I think if you have a very strong family history of allergy or asthma in the family, we have to be conservative. Generally what we'll recommend is normal formulas during the first 6 months of life, or breastfeeding. Breastfeeding is definitely preferred in that it not only may give some protection against at least the onset of allergy, but also has a lot of other benefits for the child. Once you hit around 6 months of age, that's when normally we start introducing foods. I still personally feel that if you have a risk for allergy, that we probably should be conservative about introducing foods that are known to be more allergenic. And generally what we've done in the past is recommended to withhold foods until they're 2 or 3 years of age. That recommendation may need to be validated in that we really can't say that absolutely currently. So it could be that around age 1 or so that it is okay to go ahead and introduce some of these foods into the diet. Certainly if you have a strong family history or very strong, if the child themselves are having problems with food allergies already, then you may want to withhold other types of foods like shellfish, tree nut, etc. into the diet to prevent further sensitization. Well, if I had a child and if the parents are allergic or you have siblings, other brothers and sisters already there and they're allergic, what should we do? Again, one of the most important things to do is avoid smoking in the environment. It's always amazing to me that people may worry about environmental exposures, yet they still have either themselves or other family members who are allowed to smoke in the household. Other things you may consider, if there is a very strong allergic history, we recommend starting in the bedroom, using casings on the mattress and on the pillows. This reduces the mite exposure, which is one of the early allergies that children will develop. It may be beneficial to put in that bedroom a air cleaner that has an adequate, what we call a clean air delivery rate. We recommend not using any type of air cleaners or air purifiers that produce ozone, because ozone itself is a pollutant and has recently been linked with more evidence that it causes significant respiratory illness. In the bedroom, it's best not to have animals. Again, if you have an allergic child already or there's a strong family history, it's better not to have animals in the house at all, at least if you've identified that other members are allergic. But keep them out of the bedroom at the very minimum. It may be better to delay the introduction of some of the most allergenic foods till later in infancy and early childhood. The ones we think about most commonly can be issues are egg, peanut, tree nut, and shellfish. Those are probably the four things we see the most problems with as far as early risk for either food allergy reactions or development of skin rashes like atopic dermatitis. So it's probably better to wait. In the past, we've recommended ages 2 to 3. It may be okay to introduce those a little bit earlier if you're not seeing any signs of allergies in your children. But if you see signs, sometimes they'll occur in mid-infancy, around 6 months of age. It may be better to wait at that point in introduction of those foods.